Haley, regarding your first question, I agree that the spiritual assessment should not have been administered as soon as she arrived. She was in a critical state, and I think that addressing what was going on with her and helping stabilize her was the most important issue at that part. However, I feel that after she was stabilized, a spiritual assessment should have been administered, and if it was administered, initially that first week she was there, it may have prevented a lot of the issues that came later down the line. It could have shown the husband's distress quicker, and it could have been addressed. It could have shown what the family wanted and what she wanted, and helped ease through the death process. And I think, as you addressed, there was an issue with communication. I think more communication with the family earlier, maybe the spiritual assessment would have helped with that. The doctors didn't really need to wait around and wait for the family to approach them, because the family didn't really know that they needed to approach them, and the resident and the nurse and the attending weren't on the same page. So communications not only with the family but between the healthcare team really could have helped with that. And regarding your second question, I had question 7, which was pretty similar, and it really talked about you can't really treat patients and help them fix their spirituality if you don't know what spirituality is and you haven't realized what it means to you. How can you help them realize what it means to them? So I agree that professionals need to deepen their own faith, and I think how you mentioned praying before each patient, that could work for some people. I think other things such as meditation or yoga for people that aren't religious are also a good idea. I think talking to other healthcare professionals is a really great idea, because I know some people spend more, like seasoned nurses have experienced more death than a beginning nurse, and they may know how to cope with this, or they may know who to refer you to, just stuff like that maybe you didn't receive training in school. And I too also agree that the experience that you have play a role in your spirituality. I know for me, I grew up in a church, so I was really lucky to see how pastors used their skill to communicate and address spirituality for the people that really needed it the most and could help heal them. Also, as an OT, I think our professors do a really good job at addressing spirituality, and they have showed us ways to do that with our patients. And I feel because of them, I could follow their example and confidently do the same.